Hey everyone, and welcome to the first episode of Urgent Care Unscripted. My name is Barbara Renalter, and I am the Director of Operations and Business Development for AFC Urgent Care in West Haven. And today I'm joined by my co-host, Mohammed.
Hi, thank you, Barbara, and my name is Mohammed Zaman. I am the franchisee and owner of AFC Urgent Care in West Haven. This healthcare-related episode series, Urgent Care Unscripted, has been a long time coming. We wanted to address head-on some of the critical and most common questions related to your healthcare, as it more pertinently pertains to urgent care treatments. And so we welcome you to join us in this podcast series.
And during this podcast series, we just kind of want to answer questions that might be a little bit unclear for patients. And we're going to cover things like insurances and when to go to the emergency room versus coming to the urgent care. We're going to talk a little bit about immigration physicals and much more during the series.
Before going into the details, just why are we really doing this? I mean, as you think about it, health is one of your biggest assets that you can ever have in life, right? And then when you're sick, you are compromised mentally, you're compromised physically, then the cost is involved, your families are involved in some situations, and then you have many different choices to go, and then you have a different kind of illness, and each kind of illness might need different kind of treatment or treatment facility. So many questions to address and answer and make the right decisions. What we are trying to do here is make it as succinct as possible, make it as simple as possible for the most common questions that you have to face when you're in that situation of making a choice of where you're going, how you're getting yourself treated.
Absolutely. And I think that it can be very frustrating for patients because they just don't get clear answers from sometimes their providers due to time restraint or even their own insurance companies. So we're here to break it down for you. We know that some confusion can lead to mistrust. And what we're trying to do is create a trust, a bond between our urgent care and our community. So that's, I think, where the podcast came about for us.
Yeah, and I just want to expand on what Barbara just said. It's about two things. It's about, first of all, it's about you and us creating a bond with you and having that communication between the patient and us. This is a beautiful community in West Haven that we live, and we want to reach out. We want to serve the community, and besides just running an urgent care clinic, we want to give back. When information is a big weapon in terms of your path to recovery, we want to make sure that that information is available to you on your fingertip. You can come back and watch this episode and get questions answered before you even have to pick up a phone or ask someone else.
Yeah, we just want to be transparent as we can with our patients. So to start, Mohammed, why don't you tell us a little bit about you, where you began, and why you're here today?
Of course. Thank you, Barbara, for that question. I was in supply chain, running organization supply chain for large companies. I had large teams working for me, but then in my heart, I wanted to always serve people, use my skills and knowledge of managing people, leading people to serve. And with that intent is where we started with this urgent care. This is healthcare is one of the best ways to, and a pure way to really achieve that service quality, and within that, urgent care is where we can apply our sense of quality, sense of service, and reaching out to people. So all of that, along with our desire to run an urgent care clinic in a very clean, efficient, and caring environment, and that brought us to AFC.
Yeah. And my name is, like I said, is Barbara Renalter. I have had a passion for healthcare since I could remember. I have worked within the urgent care or healthcare operations for a little over 8 years now. I started my career with the full intention of just being a nurse, bedside, and just taking care of patients. And at some point, I became really intrigued by what goes on in the background. I just wanted to make things more efficient, not only for patients, but also for the staff members as well, because I understand that when you have a happy staff, that happy staff will then translate that care and passion to their patients. So we really focus on I try to focus on making healthcare more efficient and just to make sure that it's a good environment for everybody that's involved. And I think that's why Mohammed and I make such a great team.
And we are so lucky to have Barbara here. Her mentality, her core training in process, that's so critical for patients. The patients want predictability. Patients want a smooth flowing process that they can expect when they walk in, and by the time that they leave, there is no surprise. And that's where Barbara is at her best in delivering the perfection in ensuring that the process is predictable, is transparent and clean. And along with that, I come in with the desire and with the ambition to serve people and make sure that everybody is treated equally, everybody is getting the best attention they need, and there is a certain standard of quality that healthcare is kind of like non-negotiable. That's always maintained. There is no compromise on that. So we are a great team from those two perspectives. Her skills in establishing the process and our desire and an ambition to maintain quality of service and then expand on it and make sure the whole community is treated equally and carefully.
It's definitely a good balance, and we are here to share our knowledge with our patients, our community, and hopefully, again, to gain that trust so you guys know that you have a reliable urgent care clinic to come to whenever you need it.
Awesome. And over the course of next multiple episodes, we'll be covering multitude of topics. Sometimes patients come in and get treated and they still feel like I didn't get treated or the treatment that was offered was not adequate. Sometimes patients are sitting at home and wondering, should I go to an urgent care or should I go to an emergency room? Sometimes they're wondering, will my insurance cover it or not? What if I get a large bill? What if I get denied service? What happens? What if I lost my insurance card? So these kind of questions we would like to address head on these episodes, so there's less confusion, and you know what to do when that time arises, when you're physically or mentally challenged and you need some service immediately. Those questions are answered ahead of that happening.
Yeah, and we want you to be part of the conversation. We understand that we're going to try our best to answer as many questions as we can, but if you hear an episode and you see that there's a question that we weren't able to answer, we didn't get to, we are going to have a full episode dedicated to just answering questions that are submitted by the audience and our listeners. So you'll be able to email that to westhaventeam@afcurgentcare.com. We'll also put that email for you guys so you can get that information after the episode as well.
And on top of it, to make it really succinct, to make it really rich with reliable information and knowledge, we'll be bringing in experts for you. When it's, say, a topic of urgent care versus emergency room, our medical director also happens to be an ER physician who will also be joining us. When it comes to a topic like insurance, we'll be bringing in an insurance expert. When it comes to legal matters, we'll bring in on our episodes a legal expert to also share their knowledge with us. So we will do what is needed to make sure that the information that we pass on to you is reliable, is expansive, and it's covering the topic adequately.
So if you are interested in that, follow, subscribe. And again, we're here at 354 Sawmill Road in West Haven, and we are ready to see you whenever you need it.
Thank you for joining us, and we look forward to seeing you in our future episodes. My name is Mohammed again. I'm the franchisee owner, and with me is
Barbara Ronalter, Director of Operations at AFC Urgent Care West Haven. Thank you.